like to do is just take a couple of minutes just to ask sort of our panel, what would be your key takeaways? So if you wanted the attendees to take away one, maybe two things from this event, from what you've discussed, what would that be? I don't know if we want to start with James. Do you want to run us through what you want? Jim, sorry.
Sure. I think probably the primary takeaway is that to recognize that addiction and alcoholism are illnesses that are eminently treatable. There was a time that we didn't have any good treatments, didn't understand. The only thing that we did with chronic alcoholics were lock them away into asylums, for years, if you had the money to stay there. But, today we have all kinds of very effective treatments, from the 12-step program to psychiatric agents that are effective in working with addicts, to psychological therapies that are helpful. And it's just like any other chronic disease. If you treat it, you have a good chance of living a rewarding, fruitful life. But it does require treatment. Typically that treatment's on a daily basis, just like a diabetic taking his or her insulin. The same thing is true with addiction and alcoholism. Get treatment and get it regularly and persistently. There's a tremendous amount of positive change that can come to a person's life as a result.
Thanks, Jim. This is Link. Let me just say real quickly, I don't normally do this. I've been on lots of panels in my career doing this. I can't tell you two gentlemen how pleased and honored I was to be with both of you. I thought it was a great conversation, and I don't think I've been with two other people on a panel that I listened to every word they said and was engaged. And you're so professional and wonderful. It's just, I just have to tell you, it's been a treat. So with that aside, my takeaway is that, this is about way more than practicing law. This disease hits lawyers at a very enhanced rate, and we have more problems than other professions asking for help for the reasons we've discussed. But the reality is, it is a chronic and fatal disease if it progresses. So we're talking about way more than just being a lawyer. We are talking about a disease that will kill you. And I see lots of lawyers, by the time they get to Caron, which is a residential center, it's not because they just had a DUI and they came to Caron. They've had lots of consequences, and their disease is often in the late stages. And when they leave Caron, I actually know that if they don't do the treatment program, they are likely going to die, like within the next year. So it's really sobering. I've had people die. And so I just want everybody to look at this in the framework of life and death. So if you're nervous about saying something to somebody, you're like, oh, that's really not my business, or I just don't want to even be a part of it. Overcome those nerves and that trepidation and reach a hand out, because we are talking about something that's life and death. And then the other thing I just want to say is, isn't it bizarre that today there are probably tens of thousands of lawyers with their door closed, dealing with their addiction. They are sleeping, or they are hungover, or they are sick, or they are using, but they are by themselves in their office in what I will tell you is a personal nightmare that I understand. But they would rather stay there in that nightmare than ask for help, even when they've reached the point they know they have the disease. Even when there's no more denial and they know they need help, they more times than not do not reach out for help, and they get sicker and sicker. And I say to people, I don't know of any disease where somebody would rather die than ask for help. The study that Anthony told you about asked the lawyers, what's your biggest obstacle to asking for help and getting better? And they said the biggest obstacle is other people knowing I asked for help. And I mean, talk about circular, but that's how we think. We'd rather die than have people know we needed help. And that one concept I find it riveting, and I find it horrifying, but it is true. So anything any of you on the line can do along those lines with your firms, with your own life, whatever, keep that in mind. Thanks so much.
And briefly, I have to echo Link's sentiment in terms of being on this panel. I've been just educated and thrilled to be on the panel. Simply put, I would say that the lawyer's difficulty in asking for help goes to everyone on this phone call. And by that I mean that if you're encountering someone with a difficulty, ask for help in helping them. We're all here and we all do that on a regular basis, so you need to overcome that yourself. Ask someone who knows a little bit more about what they're doing than you may, or is more comfortable with the situation than you are, and ask for help. Ask the lawyer's assistance program in your state. Ask a local rehabilitation center or hospital or a doctor for help. And you will get that help. You will get some guidance so that you go in and offer a constructive solution to a person rather than pointing out their difficulties, pointing out their shortcomings, and not having a solution at the ready, because you need to have that solution in your back pocket. You can't just go in and point out bad behavior with nothing to offer them, or you're just telling them to get out of a hole with a shovel. And that's not going to do anybody any good, and you're not going to feel much better if, as Link suggests, that person ends up hanging from a tree somewhere, or ends up killing themselves in their garage, or we see suicides in these circumstances quite often because lawyers are at their end of their rope and can't get the help that they need. Offer the help, but get help before you do that from someone that is a professional, from someone that knows what they're doing, because this seminar, as illuminating as it is, isn't the end of the story. This is really just the beginning to get you thinking about it. You need to have someone at your back so that you're not alone going into a situation that you're going to be uncomfortable with. We're not asking anyone to do that, and no one should be in that circumstance or those situations. So that's all I've got.